So we are discussing about balanced diet. So completed two classes of balanced diet. We'll continue the balanced diet lecture part 3 because it is a very vast subject or vast topic. Today we will discuss about first we will discuss about dietary fiber. In the balanced diet, the dietary fiber will play a very important role because our body needs balance. When you are taking input of food particles or solid or liquid particles, so we'll have waste products or unwanted products which need to be eliminated from the body. So for elimination of this waste products, okay, we need two systems to work in a balanced way. That is one urinary system and another one is digestive system. In urinary system, kidney, urinary bladder will work, and digestive system mostly uh, stomach, small intestine, and large intestine. So we need this three organs and two organs to be worked in a balanced way. So if the kidney and urinary bladder doesn't work proper, so what will happen? The elimination of liquid unwanted substance will not happen properly. Then the body will they will get toxin substance through it, and it will ended up a very unhealthy manner. Okay, same thing if large intestine, small intestine did not digest properly, what will have happen? Absorption will not happen properly. If absorption will not happen properly, large intestine does not eliminate the solid unwanted material from the body. Okay, so for that purpose, to eliminate the solid unwanted substance from the body, we need one type of food that is called dietary fiber. That is called dietary fiber. To eliminate unwanted substance from the kidney and urinary bladder in a liquid form, we need to intake water in proper way and adequate require according to the requirement of the body. So then the liquid unwanted material will be eliminated from the body. If you take dietary fiber, solid unwanted material will eliminate from the body. Okay, so we'll talk different types of fibers. So basically, there are two types of fibers. One is soluble fiber, which is soluble in water, and one is unsoluble white fiber. In soluble fiber, it will dissolve in water. Number one, dissolve in water, and it will not dissolve in water, not dissolve. And second thing is that the examples are oats, peas, beans, apples, citrus fruits, barley, psyllium. Okay. And insoluble fiber like whole wheat, whole flour, wheat bran, nuts, beans, okay, vegetables like cauliflower, green beans, potatoes, all these are insoluble, having insoluble fiber. So first we will talk about a role of dietary fiber in according to balanced diet. Okay. So role of dietary fiber. Role of dietary fiber. First thing is that digestive health. First is digestive health. It will promote bowel movement. Okay, to promote bowel movement and prevents constipation. So whoever have constipation is nothing but the stool becomes hard. Okay, it will not going forward even though we have peristaltic movement. So what it will do, the fiber will soften the stool and increase the uh, fluid quality quantity here, and it will solve the stool and it will maintain the peristaltic movement easily. Okay, it will make peristaltic movement very easily. First thing is that. Second is that second function of second function of dietary fiber is blood sugar control. It will control the blood sugar level. How? So because it will digest very slowly. First thing. And second thing is that it will absorption of sugar will happen very slowly, and it will control the blood sugar level, particularly for diabetic patients. Okay. And the third is cholesterol management. These are the very important benefits of dietary fibers. So this is the reason we have to add dietary fiber in for balanced diet. Cholesterol movements means it will increase the LDL level, low density lipoprotein, and decrease the HDL, high density lipoprotein, bad cholesterol. Okay, help lower total blood glucose levels by lowering LDL or bad cholesterol. Okay, this is the very important. Third is by all this happens, your weight will manage very good. Weight management. If you want to manage the weight, so you have to take more high fiber food. Okay, because they will the stomach is always full. It will take time to digest. Low glucose level will increase. Okay, gradually it will increase. Okay, and next is gut health, weight management, and fifth one gut health, because it will eliminate all the unwanted material from the gut. So the it will maintain the gut quality. Okay, so this is very important. Next is how much amount you have to take. Okay, how much amount do we need? RDA, you need daily 38 grams. 38 grams from up to 50 years. Okay, from 21 to 50 years, you need 30 grams. 25 to 30 grams. After 50 years, you need 38 grams because the every body functions are gradually decrease. So that's the reason we need more. So this is the important things we have to remember. What are the health benefits? You will prevent your constipation or hemorrhoids, and cancer of colon is to be protected. and the cardiovascular health, because to maintaining the cholesterol level, increasing good cholesterol, decreasing bad cholesterol, and as well as, yeah, managing diabetic will be easy. Weight management, overall gut health will increase. So which food have more fiber? We have five types of foods which have fiber. That is, first number is fruits, second number is vegetable, third is legumes, fourth is whole grains, and fifth is nuts, nuts and seeds. So every patient, everyone need to take this to increase their gut health, to improve their gut health, like apple, banana, okay, oranges, strawberries, raspberries. Everyone have large amount of fiber. Vegetables like carrots, okay, beetroot, broccoli, collard greens, bruce sprouts, etc., etc. Beetroot, radish, cauliflower, okay, legumes in the lentils, black beans, kidney beans, chickpeas, etc. Whole grains in whole wheat flour, barley, brown rice, bran flakes. In nuts, we have almonds, flax seeds, chia seeds. This will have large amount of a large amount of fiber present. Okay, so these are the very important fiber, dietary fiber, which is very important to eliminate the unwanted things. So now, uh, now we have to meet the we have to do planning for meal. Okay, so first thing is that what are the goals, why you are what type of planning you have to give. This is the very important thing. Okay, we have to remember five things whenever we are planning a meal. One is balance, means in that we will include all the varieties of food. Whenever we are giving meal planning, you have to include all the varieties of food. Second is moderation. Okay, means uh, one food can't be will take a longer duration. In that you have to include other type of food, variety of food. Next is a nutrition density. You know to need you have to know about that, which food have what type of nutritions and how much amount you have to consume. And personalization, last one is personalization, means for why they are taking the plan meal plan. Okay, meal plan very important. So next, assessment. We have to for making a meal plan, you need assessment. Assessment mean age, okay, uh male, female, okay, what type of work they will do, physical work, mental work, okay. Likewise, you have to calculate everything. And goal, why they need, okay, why? For weight management they are asking, to improve the overall health, to improve the skin quality. For hair fall, they are asking the diet goal. For neck pain, back pain, calcium deficiency, for what purpose? Is clinical. Next is menu creation. Now you will have menu creation. In that, protein, carbohydrates, fats, minerals, and vitamins. These four types of food you have to include. Next, fourth one is need to shop that. Okay, need to shop that. Now you have to advise the person. You have to bring all this at what time at once, to save your time, save your money, as well as shopping list. You need to write it and give it to the person. Shopping list. Next, fifth one is preparation. How to prepare? You have to give the clarity about that. And evaluation. That means you need to ask the patient Are the person, are you following this diet, whatever I gave to you? So this is the basic 6 steps involved to make a great meal plan. Okay, so this is the basic thing you have to remember. Now, one another topic is there now that they will discuss. So now we'll talk about infant and young child feeding guidelines. Young child feeding guidelines. So whoever practice feeding, okay, for infants and young children need to follow this guideline. Okay, this is two centers who are recommending that, that is World Health Organization, WHO, WHO, and is UNICEF, National Health Authorities. Okay, first is the uh, we have three types of feedings. One is direct feeding, whoever giving breastfeeding like. Second is complementary feeding, and third one is HIV and infants feeding. Okay, so we'll talk all these three. First is infant breastfeeding. Importance: milk is the ideal and complete nutrition for infants. It provides essential nutrients, antibodies. Okay, we know that IIG will get from the breastfeeding only. Antibodies and promotes optimal growth and development. So, breast milk will give nutrients, antibodies, promotes optimal growth and development. So, already benefit is there. What is the benefit? You will get the nutrients, proteins, fat, vitamins for the infant, minerals, everything is there. Immunological, because they have antibodies to fight against the diseases. Okay, and psychological benefits. The bonding between mother and child will grow. Okay, these are the benefits of breastfeeding. Initiation: ideally, breastfeeding should give within the first hour after birth. Okay, early initiation help establish a strong bond and ensure colostrum intake. Okay, duration: the World Health Organization recommends exclusive breastfeeding for the first 6 months. Continue breastfeeding alongside complementary foods for up to 2 years or beyond. Okay, we know all this. That challenges: latch issues. Some infants may struggle with latching onto the breast. Low milk supply. Some mothers may face challenges in producing enough milk. So what we have to have solution: seeking support from healthcare professional, lactating consultants. Okay, ensuring a comfortable and quiet environment for breastfeeding. Okay, so some reasons are hormonal imbalance. We need to consult what type of hormonal imbalance are there. Okay, and you have to train the mother and as well infant for breastfeeding. So this is the benefit of breastfeeding. Now, next is complementary feeding. Second is complementary feeding. Complementary feeding is the process of introducing solid and semi-solid foods alongside breast milk. Okay, along with breastfeeding, we need to give some semi-solid, solid food during that intermittent. Typically starts around 6 months. So you have when we have to start, we have to start within 6 months. Okay, when breast milk along there is alone is no sufficient. Okay, principles: introduce complementary foods at the right time around 6 months. Okay, offer nutrient rich foods to meet the growing needs of the children. So we have to give nutrient rich food. Gradually transition from porridge to more extended fooders as child develops. Gradually you have to increase like iron rich food which will prevent from anemia, fruits and vegetables which will give vitamins and minerals. Mostly now I saw most of the persons will not give fruits vegetables to the infants. So uh, they have fear anything will happen to them. So it is very bad. Some you also you will give protein sources also like meat, fish, egg. Okay, whole grains which have very rich in energy and fiber. Okay, sometimes what happen, some uh, infants babies will have allergy, so you need to understand what type of food are allergy to them, then you have to stop that, not to use that things. Okay, so this is very important, and you have to follow the hygienic and safety very well while cooking, while preparing the food for the infant. Okay, so this is the complementary feeding. Okay, and direct breastfeeding along with complementary feeding is very important after 6 months. Next is HIV and infants feeding. HIV, human immunodeficiency virus, can be transmitted from a HIV positive mother to her infant during pregnancy, childbirth, or breastfeeding. The risk of transmission through breastfeeding excess become HIV can be present in breast milk. However, strategies have been developed to minimize the risk while still recognizing the importance of infant nutrition. Here are key considerations related to HIV and infant feeding. First, prevention of mother to child transmission. Pregnant women living with HIV are advised to take uh, whatever treatment they will give. They have to take the treatment. Will not go will not go in detail. Next is exclusive breastfeeding in resource limited settings where safe and affordable alternatives to breastfeeding are not available. Exclusive breastfeeding is recommended for the first 6 months. Extended antiretroviral prophylaxis. They will give treatment along with they will give breastfeeding. Or else we have second option, replacement of breastfeeding. Okay. Support, we have to take support of health care provider or proper counseling and support for mother. Or mixed feeding and this mixed feeding are dangerous. Okay. So these are we have to give the education and support. So we will these are all these are counseling. Okay, will our we have, doesn't have authority to go. So they have that thing. They will advise, healthcare provider will advise this all those things, what to do, what not to do. Okay, so these are the uh, recommendation RDA or WHO advice for the breastfeeding mothers and for their infant. Okay, so this is all about in today's class. We will discuss a diet plan from children, adolescents, and elder and pregnant lady. So we'll make a diet plan for all of them. So our diet, balanced diet topic will complete. So tomorrow we'll make a diet plan for all of us. So children, adolescents, elder people, and pregnant women. So any doubts, kindly ask.